Hello and welcome to the second ever episode of Dr. Jason Live. I'm so glad you're here. For those of you joining live, really glad to have you, and I'm really looking forward to seeing your questions that I'll answer here on Dr. Jason Live. For those of you who are tuning in afterwards on the Dr. Jason channel to watch this rebroadcast, thank you for tuning in. Thanks for watching. And feel free to put in the comments of this video questions that you might have for the next Dr. Jason Live, and I'll try to get to those next time around. For now, the Dr. Jason Live is going to be the first Wednesday of every month from 7 to 7:30 p.m. Central Time. So do be sure and tune in, and you'll have your opportunity to ask your parenting and pediatrics questions from a real board-certified pediatrician. That's me. I hope you've maybe checked out some of my recent videos. The music video for Car Seat Check was, I think, my most recent one, so I hope you checked that out and enjoyed it. If you don't, after tonight's live broadcast, check it out. It's a couple minutes long and has some great information about keeping your kids safe when they ride in the car, which is a lot trickier a thing than you would think of. When I installed car seats for my own kids, and they're only a little bit better now, I really realized that it takes a fair bit of effort to get a car seat in so it's not wiggling, it's not moving around, it's not loose, and it's going to safely hold your child. I used to joke that if you didn't hurt yourself installing the car seat, you probably didn't do it correctly, which is not far from the truth. It takes a good amount of effort to get car seats properly installed and get them secure for your kids. So check out Car Seat Check, my music video about that. And there's also some tips on other places you can check in the comments of that video and in the video itself to get more information about car seats to keep your kids safe in the car. Got a video coming up really soon about breastfeeding. That's going to be one of the next videos. It might even be 2 videos. I'm not sure. I got a wonderful guest who really knows her stuff. Caitlin Haley is a certified nurse midwife and an international certified lactation consultant. And she just did a smash-up job of really giving the basics for breastfeeding your baby. And I talk a little bit about some of the reasons why, and also troubleshooting some of those difficulties that some new moms have in breastfeeding babies. So check out that video. It's going to be coming really soon, as soon as I get it edited and I'll put together on the Dr. Jason channel. So, so do check out that. So thanks for joining me here for Dr. Jason Live. I have some questions that came to me in between the last Dr. Jason Live and now, as we're waiting for some messages, some comments to come in to some questions that I can answer for you here. I'll talk about some of those. Now, one of the things that people wanted to ask me about was about potty training. And this is perhaps something that causes a lot of stress to some families and almost none to others. Because some babies, some kids basically potty train themselves, and some will take a lot of effort to get it done. When I did potty training for my kids, I had 2 kids, and they both kind of went in a different way. Now, the first I didn't necessarily do as much research, perhaps, as the second one, and it was a rough, difficult process. The second, I went through the Azrin and Fox method, which is called toilet training in less than a day, and I'm going to talk about that in just a minute. But I basically did that for the day. It didn't quite take as expected, and then I think a few weeks later, he pretty much potty trained himself. And when I say a child potty trains themselves, I basically mean they pretty much just get to the point where they don't require any additional prompting or training. They just do it. So there's lots of methods for potty training, for toilet training. And in some cultures, there is a method that they'll say they start potty training at like 6 months old. And this is perhaps a little deceptive when you think about, what we'd conventionally think of as potty training. Basically, Parents who spend so much time with their babies can really learn their cues very well and learn to recognize when a child is about to or is needing to go, and basically hold them in a position where they can go into the toilet or into the potty. I don't think of that as toilet training per se, but it is an early start, and some kids can do that as young as 6 or 8 months old. Most babies in Western cultures, at least, will toilet train sometime between the ages of 2 years and 4 years. I know that's a big range, but it truly is, normal for a baby to toilet train at 2 years old, and completely normal if they're not toilet trained until 4 or almost the fifth birthday. I mentioned a method, the method of Azrin and Fox. Those are the authors of the book. I think it's Nathan Azrin and Richard Fox, but the book is called Toilet Training in Less Than a Day, and the authors are Azrin and Fox. They were developmentalists, and they were working on a method to accomplish toilet training for kids with intellectual disabilities, older kids with intellectual disabilities. And what they found was their method worked very well for all kids. Just the timing was a little bit different based on their developmental abilities. Their book is really pretty good. It's a little deceptive. The title is Toilet Training in Less Than a Day, and really, there's one day. There is a day that you go through, and you go through the, and basically you're spending this day feeding your child liquids and keeping them close to the potty. But there is some setup for that. You really do have to prepare for it, in that your child has to be familiar with what the potty is and what the toilet is, how it works, and the idea of using the potty before you can really do this. And then even afterwards, you do have to do a little bit of follow-up and encouraging your child to use the toilet appropriately. It's a good book. I can't go over all of the book in this short time, but it's a good way to think about, or a good way to get started on toilet training for your child. And I probably will do another video at some point in time on toilet training. The thing about it is, don't get too frustrated about it. Don't let it be a battle, because then the child will resist it. And that's the problem I had with my first, is that at least on a subconscious level, he was resisting, and then it gets to be harder to accomplish the goal. So you don't want to make it a battle in any way. You sort of have to go at the child's own rate, and don't be alarmed if it takes till they're closer to 4 years old. But you do want to make sure that they're exposed, that you introduce the potty to them, show it to them many times, tell them what it's for, let them observe adults properly using the toilet. That will get them the familiarity that they need with the idea, so that they will toilet train. And I'm going to leave that at that. Like I said, I'll probably do another video at some point in time on toilet training. If we have some specific questions about it, I would love to be able to address those as well. Some questions about eczema. Now, I did do a video about eczema, and do check it out. And there's also a lot of other videos available about eczema, both childhood eczema and adult eczema. Eczema is super common in kids in some form or another. Kids who have eczema are more likely to have allergies or asthma, and kids who have allergies or asthma are likewise more likely to have eczema. We call it kind of the allergic triad, and it's something that medical providers really look out for, because if you have one, you might have one or more of the others, and that can be a hint for you. But I just want to talk about eczema itself. Oftentimes there are triggers to eczema. There are things that cause the reaction. Eczema can look very different from child to child. Some, it will cover their whole body. In many, it will localize itself to one or more specific locations. Common ones are the face, the cheeks, and the elbows, the backs of the knees. Those are some common locations, but it can be anywhere in the body. It can be diffuse, or it can be very focal, very much in those little areas there. There are often triggers. It's related to allergic or to allergies. So it can be anything that touches the skin. Sometimes it can be things in the environment or foods, but more often we think of eczema as being more of a contact thing. So if your child has eczema, it's always worth looking for, are there things in the environment that could be triggers? Oftentimes you can't find them, but it's still worth looking for them. And common things that are triggers include, particular articles of clothing, could be a dye or, coloring or the fabric, something that the skin is reacting to. Sometimes a soap, a laundry detergent, a cleaning chemical that is on the floor if the child does a lot of crawling around on the floor, a lotion or a soap that you're using to keep the child clean could be contributing to eczema. And one of the common mistakes I think that many families make is, presuming it's a laundry detergent, and it's worth using the anti-allergy laundry detergents. You can use like an All Free and Clear or Dreft, those laundry detergents that are either labeled for babies or labeled for allergies. Either one is going to be fine, but don't just use those for the baby's laundry. Use it for the whole family. And the main reason for that, if you think about it, many babies have eczema on their faces. That's a common thing. Well, their face may actually come into contact with more things than you think. Not just the things that you may put on their face. Their foods literally can be on their face. And when you hold your baby, you're holding them so that their face may be up against your shoulder, touching your clothing, and so that they really are exposed to not only their own clothing, but your clothing and the soaps and laundry detergents that you use to clean your clothes. So I recommend using those anti-allergy laundry detergents for the whole family, everybody's laundry. Do it all in those laundry detergents to make sure that we don't, that's not a source of something that can irritate the baby. Skin irritants for babies oftentimes include dyes and perfumes. So if you have a lotion or a soap that has a pretty color to it or smells nice, that could be the problem. So try using a soap or lotions that have no dyes or perfumes in them, that are unscented, that are clear to whitish to just off white in color. And Aveeno Baby makes an unscented that is pretty good. The usual Johnson & Johnson things that have been around for years, they smell really nice because they have the perfumes in it. They're not great for babies with allergies. And they do make a dye-free version, but I believe it still has a scent to it. So I don't particularly recommend that one. Even the adult lotions and skin creams that don't have dyes or perfumes, like Cetaphil, CeraVe, those are pretty good. And I do recommend using them because moisturizing the skin is another key to taking care of eczema skin and reducing flares of it. So a good regular application of a laundry, a good regular application of a dye-free, perfume-free skin cream or lotion will help to reduce flares of eczema. Now, when eczema flares, it usually requires a medicated treatment then to bring it down. So I recommend you then bring the baby to be seen by their healthcare provider, and they can provide a mild anti-inflammatory, like a steroid cream, that really will help to reduce the inflammation and the irritation there. And it may just be hydrocortisone, which is technically available over the counter. It's good stuff for sensitive baby skin, but let your healthcare provider make that call. Have the healthcare provider take a look at it, particularly if it's red. If your baby's scratching at it, seems to be itchy, that's when you want to get it checked out, and your healthcare provider can provide some ready things to help improve the eczema. I'm seeing that I have some messages in the chat, but I'm not seeing the messages. So let's see if we can. Well, if you put a question in the chat for me, I'm not seeing it now, and it looks like maybe the thing that says as a message was just a new person joining. So if you have your question, please enter it in the chat, and I will I will answer those questions here. So I spoke a little bit at the beginning about potty training, and then talked a little bit about eczema. Another common thing I get lots of questions about this time of year is respiratory infections. We're in the winter, in the middle of the respiratory season, and different areas have different things going on with the respiratory season. For example, around here, I'm in Iowa. We just are kind of getting to the point where flu is decreasing a little bit, but they're actually expecting it to come back up. The influenza virus, a common cause of respiratory illnesses. Respiratory syncytial virus, or RSV, is common this time of year. Again, it's starting to go down, but we can't be sure it's not going to come back up again. Usually we're still seeing RSV into April or so. So that's, a common virus that we're seeing. COVID is still infecting a lot of people. And fortunately, it doesn't tend to be as severe in kids who don't have other underlying medical conditions. But COVID is one of those things that's just been really unpredictable in what it does. So you might not, in a perfectly otherwise healthy person, it can be a really devastating illness. And in someone who has underlying medical conditions and ordinarily has breathing problems with common colds, sails through COVID without too much difficulty. It's really variable. And then the usual players this time of year, viruses like rhinovirus and adenovirus, metapneumovirus. You don't need to worry about the names of these viruses, but you should know that at any given time, in any given community during the fall and winter months, particularly, a little bit into the spring as well, there can be dozens, scores of different respiratory viruses going around. And that's what makes treating them especially difficult, because kids will seem to be sick for long periods of time. And what probably happens most of the time is not that they have a more severe illness or something creeping in over the top of it, which they can have. I'll talk about that in just a second. But a lot of times kids will get more than one respiratory virus, and they'll get another one before they really even got better off the last one. So an ordinary respiratory virus can have symptoms that can linger on for 2 weeks, plus or minus 2 weeks. It can be a long time. But when you add on top of that another respiratory virus before the child is completely recovered, you can see kids who are coughing and with snotty noses through the entire winter season. Most of these viruses are pretty minor. They're really, they cause problems for families, problems for kids who just don't feel good. But from a medical standpoint, they usually aren't serious. The times when you want to be really aggressive about making sure that your baby with a respiratory virus gets seen by their medical provider, anytime they're having difficulty breathing, they just can't catch their breath, or they're breathing really fast, particularly at rest. That fast breathing is oftentimes a sign of what we call respiratory distress. We're not breathing well. When a baby takes a big, deep breath, or when they cry, or when they sigh, sometimes when they make loud noises, you might see ribs. You might see in between of their ribs, or where the tissues of their chest come together. But when they're at rest, when they're breathing quietly, you should not be seeing those things. That's what we call retractions, and that's a sign of breathing problems. Your child should be seen probably right away if you're seeing those in a baby who is breathing, who is at rest and showing you those breathing problems. Many babies will have fever babies and kids will have fever with respiratory infections. It's part of how the body's immune system attacks the virus. Truly, the fever itself is not necessarily a sign of how severe the illness is. And in fact, I oftentimes tell parents, that temperature itself doesn't hurt your child. It's the fact that the temperature makes them feel yucky that we want to treat, right? Don't treat a number on your thermometer. Treat how your child is feeling. So if their temperature isn't quite to that fever range, but they're feeling yucky, go ahead and give them some Tylenol. For older kids, they can have ibuprofen as well. Try and stay away from that in babies, but for older kids, they can have that to help make them feel better. And always check the label carefully. Check with your healthcare provider to make sure you're giving the right dose of any of those medicines. There aren't really, other than than fever reducers, there aren't really any medicines that we consider to be safe or effective to treat cold and respiratory infections in babies. There aren't. So, you treat the fever to make them feel better, make sure they're getting plenty to drink to help with the cough and the congestion. For babies, their regular breast milk or formula is fine. You shouldn't give them any plain water. You shouldn't really give them anything else. If they're really not taking the milk or formula, you can give them a little bit of Pedialyte or pediatric electrolyte solution. But for the most part, they should still eat as they normally do. Be aware that when we're not feeling great, maybe having some stuffy nose that makes it a little harder to breathe, a lot of babies will not want to eat as much. And you can make up for how much they're taking at a time by feeding them more often. So just keep in mind that your baby should really eat the same amount, but they may take less at a time when they're not feeling good. Make up for that by offering them milk or formula more often. For older kids, water is fine. There is no real need to use. You can use Pedialyte if you want to. Gatorade tends to have too much sugar in it, so I don't really recommend that. I don't recommend sweetened drinks like sodas. Having said that, the most important thing is we're getting fluids in, and if it takes giving them a sweeter drink just to get them to drink, sometimes that helps. For a child who's not feeling good, they can go several days without eating much of anything. Not a big deal if the appetite is down. Just make sure they're drinking well. That's the most important things, that we're getting plenty of fluid in. Normal body temperature, 98.6. We'll consider a fever. I always consider plus or minus 2 degrees. I think that's the easiest way to remember. Medical journals will have 100.4, 100.5 or more than that. So 2 degrees off of 98.6 is 100.6. So greater than 100.5 degrees. 100.5 is pretty easy to remember. That's what I technically consider a fever. But remember what I said before. We treat how the child is feeling, not the number on the thermometer. Now, having said that, most of the time, your cold viruses, your respiratory illnesses have low-grade fevers. Their temperature is, in that 100 point something, maybe 101 point something. If we're getting up close to 102 or more, we tend to be more concerned about other infections. Not that a respiratory virus can't do that. It certainly can. But if your child has a fever of more than 101.5 is kind of the cutoff. It's arbitrary. I'll tell you that. But more than 101.5, definitely 102. I'd say bring the child in, let their healthcare provider take a look, and make sure that there's not something else going on. Are there signs of a sinus infection? Are the ears clear? Is there signs of an ear infection? Could they have a throat infection like a strep or something like that, which typically may have higher fevers than an ordinary respiratory infection? Those are probably the main things I want you to know. There's not much you can do about runny nose and stuffy nose. In babies, you can suction out their nose with the bulb suction. You probably were given one of those at the hospital when the baby was born. They're inexpensive. You can buy them over the counter. A big bulb with a little end on it to suck things out. Oftentimes, it's more helpful to use a little bit of saline nose drops or nasal spray along with that. And I'll tell you how to do that. I'm going to do a video showing you how to do this at some point in time, but I'm a little behind on making all the video ideas that I have. But you do one nostril at a time. A couple of drops of that saline, and or just one spray. For babies, it's usually easier, the drops. The older kids, you can do the spray. Let it sit for just a couple of seconds, then suck it back out with the suction. That saline helps to loosen up the mucus and helps to make it so that suction works better. Saline is basically just salt water. It's not really any medicine. You can do it as often as you want, but really be careful when you do it so that you're not irritating the lining of the nose with your bulb sucker, because you can do that too, and that'll make things a little bit worse. So gently, but you can do that when you need it. You do one nostril at a time, one and then the other, and that oftentimes does help. During the winter months, the air is oftentimes very dry, and that dryness does make at least coughing worse. It probably also contributes a little bit to congestion, maybe not so much nasal drainage. But for that coughing, if the air in your home is dry, it's probably helpful to run a humidifier or a vaporizer, particularly at night. Oftentimes helps kids sleep. And if you're just using water to humidify the air, you can do that at any age. Additives to the humidifiers or vaporizers, there's a vapor mist type of things. I'm not a big fan of those, to be honest with you, and the main reason is that they can be concentrated enough that they can be dangerous should a child get that actual solution and ingest it. They probably are not harmful to anybody, but I typically don't recommend them in babies. Older kids, fine, but it's actually tends to be more effective to use the vapor rub types of things, and rub those on kids' chest or their feet. Actually, will help too. The thing you don't want to do with that is put it on their clothing. The reason for that is that it works on the skin. It's true, some of it is absorbed into the body, but it works on the skin. It's not designed to be ingested. And for kids who might grab their clothes and stick their shirts in their mouths or things like that, I've seen that more than I can, more often than I can think right now. But they can actually ingest that stuff. If it's just on their skin, yeah, a little bit gets on the shirt, but it's not usually enough to make a difference. But if you're actually putting it on the clothing, it can be. So we don't want kids to ingest that stuff. Don't put it around their nose or mouth either. Put it on their chest or on their feet, and that's how it works. That's how it works the best. Like I said, no real medicines, but in older kids, not in babies, older kids, older than a year old, you can give them honey to help break up a cough. Honey works better than any cough medicine, and it's it's cheap, it's readily available, it's a food. So you're not going to overdose anybody on honey. You can give them as much as they want, as much as it takes to break up that cough, and help them. The one thing about honey is honey does have a lot of sugar in it. It's a more natural sugar than the sucrose that's in sweetened beverages. But kids who have diabetes should not use this trick. Do not give honey for a cough to a child with diabetes. And just keep in mind that kids are getting a fair amount of sugar with the honey. Make sure their teeth are well brushed, of course, and for a short period of time, we don't worry too much about it. But if you're giving it over a long period of time, that could be a fair amount of sugar. So we don't necessarily want to give a lot of honey all the time, but it's the best thing for cough. It really does work well. Now, grandma's old chicken soup remedy, that actually works. There's good scientific evidence for it. Giving kids chicken soup while they're ill, and the reasons we can theorize, right? We can imagine that warm, salty liquid probably breaks up a lot of the congestion, and breaks up some of that drainage that may trickle down the back of the nose and the throat, causing coughs. There's something about the chicken stock or the chicken broth that actually seems to help the immune system, may help the body to get over it a little bit quicker. And of course, it's a source of fluids too. Grandma's old chicken soup remedy. Go ahead and give it to your child with a cold or respiratory virus. Again, not a trick for babies though. Because that they can actually get too much salt from the chicken soup or too much water. But it's usually too much salt, and that can contribute to dehydration if they get dehydrated. And I don't want to bore you with all the things that these electrolytes can do that are in the salt. But this is not a trick for babies. For kids older than a year old, it should be fine. So I don't see that there are any questions for me in the chat. So I'm going to go ahead and wrap up this episode of Dr. Jason Live. I look forward to seeing you next month on the first Wednesday of the month. I think it is March 6th, maybe. But the first Wednesday of the month, 7 p.m. Central, right here on the Dr. Jason channel. I will answer your questions. And if you want to get questions that you'd like answered to me ahead of time, you just put them in the comments for this video right here. I'll take note of them and I'll talk about them next time on Dr. Jason Live. Thanks again for tuning in. Parents, it's tricky. You got this. We'll see you soon.